Welcome back to Studio 10, everybody. It's Monday. That means it's time for On Your Health. This is where we discuss important medical and health topics with the doctors of Florida Medical Clinic, and they are the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof.
And today we're joined by orthopedic surgeon Dr. Richard Gray, who is going to talk about an amazing new treatment for an age-old disfigurement of the hand. Dr. Gray, first of all, welcome to Studio 10.
Thank you.
We've been seeing those commercials. I think they were even on during the Super Bowl. The guy, he's trying to paint and his hand is like this, and he's trying to put the masking tape on and the paint's all streaked up. Is this the same thing we're talking about?
Yes, it is, because one of the nice things is we're sort of leapfrogging onto a national release of this medication, which has been FDA approved and FDA studied, and we have follow-up studies on it, but it is just more recently becoming available and becoming popular, and they've started an advertising campaign.
Explain what exactly the disfigurement is, and is it something that folks are born with? Does it develop over time? What is it?
What we're referring to is Dupuytren's disease. Dupuytren was a French surgeon in the early 1800s whose medical student actually supposedly made the report on the disease, and he took credit for it. And that's hearsay. But anyhow, it did get named after Dr. Dupuytren, and that's what we refer to. Many people have referred to this as Vikings disease because of the predominance of the Northern European social strata. The occurrence in non-whites is incredibly rare. So Asians, blacks, Latinos, everybody else, fortunately, just doesn't seem to get this. This seems to be mostly Northern European disease.
Huh.
To the best of our knowledge, it's genetic. It's familial. It may skip a generation, but for the majority, if someone in your family has had it, you're at risk for it. It's 10 times more common in men than women. It presents earlier in men than women. It usually doesn't show up until past their 40s. So you may first notice a nodule or a lump in your palm in your 40s that may over time progress to become a full cord across your palm and then grow to your finger and then begin to develop the contracture of the finger.
So you feel,
you can't move it, right?
So it'll be a nodule in the hand. Will it be painful?
Most commonly the presenting is a nodule, and it commonly is not painful, but it's right in a portion of your palm where you grip things, so you're aware of it fairly quickly, and of course you may be concerned about it. You come in to be seen for this mass in your palm, and they may then tell you this looks like Dupuytren's and it's a benign disease, not to worry about it, but it is likely to be progressive.
Well, and obviously that's going to be very limiting for people in most kinds of employment to have your hand be sort of unusable at that point.
It is a problem with grip. It is a problem with even shaking hands. You can almost always immediately tell that somebody has Dupuytren's when you shake hands, and it feels like their fingers are folded up in their palm. But functionally, they have trouble getting their hands into their pockets. They have trouble getting their hands around larger objects. So
I would think using a keyboard even.
There is a functional problem to it, so they may be the hunting peckers.
So what exactly causes this, and how is it treated?
Well, again, the cause is not truly known. We blame it on genetics, we blame it on familial inheritance, but we don't absolutely know.
Let me ask you something. If you're right-handed, are you more prone to get it in your right hand, and vice versa for the left hand?
More aggressive disease is bilateral, so if you have it in only one hand, you have a lesser form of it, and it does not have a predilection for your dominant hand. So you may get it left or right, but if you get it in both hands, you have a stronger family diathesis toward it, which means typically you have a more severe case and it's going to be more aggressive.
How did they used to treat this?
In the past, it has always been surgery. Your only option was surgery because this is a overgrowth of normal tissue, and there is no way to turn off the growth, and so surgically we have just simply cut it out. That's not truly a cure. It removes the disease portion, but all of the cells have the same DNA, which is going to turn on the same process. It can occur in any finger, but your ring finger is the most common and usually the presenting finger.
Can it come back? I mean, once it's cut out? It can?
Yes.
Oh, wow.
So that's the idea, is that the cells are still there, ready to redevelop.
Correct. There is no procedure that can completely eliminate every one of these cells from your palmar fascia. It can occur in other parts of the body, but the hands are, of course, what we're here to talk about today.
So what is the treatment now that is replacing or at least becoming an option for some folks rather than surgery?
Far and away, still the most common procedure is surgery. There is this new product, which we're here today to discuss, which is an enzyme. It's an enzyme created by a bacteria. It is fairly specific for the type of collagen that forms your Dupuytren's cord. You inject it into the cord, and it essentially begins to dissolve the collagen in your cord and weakens it so that 1 to 2 days later you can then manipulate the finger and rupture the cord. Again, it's not a cure for the disease. It doesn't treat nodules. It doesn't treat all the contractures and thickening that you have. But if you have a palpable cord that is causing a contracture of finger, that is a ridge you can actually feel in your palm, then some of these are amenable to an injection with the enzyme and then a manipulation the following day to rupture it to bring your fingers back out straight.
So then after the 3rd day, how long before you get normal use of your hand back, relatively speaking?
Right, that's a good question, normal use. You have immediate motion of your fingers.
You do?
As soon as this cord is ruptured, you have immediate motion. In fact, that's what you always do after you rupture them, is go, make a fist, straighten out your fingers, make a fist. And you watch them in the office, and of course the patient's usually pretty amazed that they can do it that way. And sometimes you are too. But it is remarkable that it's immediate that they have this range of motion.
Is there any way to prevent this disease, or is it just something that if you're genetically predisposed, then it just might happen?
To our knowledge, there's no prevention because our understanding of why we have it is limited, and we think it is genetic, so therefore there isn't anything we can change.
So again, we're talking about Dupuytren's Contracture.
That's correct.
Dupuytren's Contracture. Don't check it out. Well, nice to see you, doctor. Thanks for being here.
Thank you for having
me. Hey, if you want to learn more about the latest advances in patient care and medical research, by all means, go to floridamedicalclinic.com, go to studio10.tv. While you're at floridamedicalclinic.com, by all means, click on the link to take you to their Facebook page and register for a chance to win an iPad 2. How about that?
Very cool.
More toys.
Fantastic. Thanks again.
Thank you, doctor. All right, up next, yoga at Sunken Gardens. Stick around. We'll be right back.
This segment was sponsored by Florida Medical Clinic.